Funding for the Maddy Report is made possible by grants from BNSF Railway, moving our economy for 160 years. Harris Ranch Resort, providing Western hospitality and award-winning cuisine. The Wonderful Company, committed to growing a better world. Comcast, connecting people to the moments and experiences that matter most. Producers Dairy, nourishing one life at a time. The Spencer Family, and Fresno State Associated Students Incorporated, students serving students. The Maddy Report is also made possible thanks to contributions from Cook Land Company, E&J Gallo Winery, the Fresno Association of Realtors, and California Manufacturing and Engineering Company. From the Maddy Institute, the Public Policy Institute for the Valley's 4 public universities, this is the Maddy Report with Executive Director of the Maddy Institute, Blake Zante.
Welcome to the Maddy Report. I'm Blake Zante, Executive Director of the Maddy Institute and host of the Maddy Report. Today we'll be discussing the major trends and unique challenges of mental health care in California with state and local leaders. I'm currently joined by Susan Holt, Fresno County Behavioral Health Director and Public Guardian. In recent years, mental health in the U.S. has been a growing concern, exacerbated by the COVID-19 pandemic. According to the 2024 State of Mental Health in America report, nearly 23% of adults experienced some form of mental illness in the past year, equal to about 60 million people. Fresno and the wider Central Valley face unique challenges regarding youth mental health, whether it's access to services in rural areas or higher rates of poverty and trauma exposure. So Susan, help us sort of digest this. Can you sort of just tell us and start by explaining what has been going on regionally to support early intervention and prevention for youth? And maybe if you could talk a little bit about what sort of role Fresno, county behavioral health departments play in the overall healthcare ecosystem.
Thank you so much.
Yeah.
I'm thrilled to be here with you and to talk about behavioral health and youth mental health in particular. So the role of a county behavioral health agency is a unique, carved out element of the healthcare ecosystem. So county behavioral health agencies operate as both a health plan and a provider of services, but for a narrow population. So we are under contract with the state of California to be the specialty mental health plan for Medi-Cal members and persons who are uninsured and have inability to become insured and would otherwise meet medical eligibility for Medi-Cal. So that's a very narrow population that county behavioral health agencies serve. With that, we do provide mental health services to all ages and all regions of our county. So each county serves as the plan within the state. And so counties have had the benefit of multiple funding streams. I think we've been underfunded for a very long time, but within the funding that we have had, we have multiple funding streams. One of those is the Mental Health Services Act, which has been in existence since 2004, so we have 20 years of experience, and I think we may talk later about some of the changes ahead with that act because of Proposition 1. But for 2 decades nearly, we have been providing prevention and early intervention services. And here in Fresno County and our region, we have those unique challenges with our vast geography, many different regions of a large county, multiple languages, the rich diversity in our community bring unique challenges to meet the demand.
Yeah, and you referenced Proposition 1, which recently just passed in the state of California back in the March primary election. Talk a little bit about that, statewide intervention and sort of how does that play a role in the early intervention of mental health, particularly with regard to youth?
Okay, so there was 2 components of Proposition 1. One component was the Bond Act. And in the Bond Act, the bond component of the bill, or the proposition, pardon me, there are 2 components of funding that will be competitive grant applications. The first of those allows counties and other entities to apply for funding to build out our infrastructure. So for example, in Fresno County, we have support from our Board of Supervisors to apply for funding for a psychiatric residential treatment facility for youth, which we believe is a really important asset to bring to our county so that we can continue that emphasis on being upstream to prevent the consequences of untreated mental health conditions. The other big component of Proposition 1, aside from the bond funding, is the massive changes to the Behavioral Health Services Act, as we will now know it, formerly known as the Mental Health Services Act. So the Act does not create new money for Mental Health Services Act dollars, remain the same. Actually, counties will receive less under the Proposition 1 changes because the state is shifting the prevention dollars to the state level. So we've spent prevention and early intervention money in our community, wonderful investments in our schools, in community-based organizations, in the neighborhoods of Fresno County to prevent the negative aspects of unaddressed trauma, the unaddressed social determinants of health, preventing deaths by suicide, and really lifting up the youth. And so as Proposition 1 changes our funding beginning in middle of 2026, we will actually have fewer dollars for prevention and early intervention, with the state taking those prevention dollars off the top. So that's a big change ahead, and there's a lot of wonderful things about Proposition 1, and we're excited to bring those changes to our community. The flip side of that is that there are some hard decisions ahead of how we transition the things that we've been doing with our prevention dollars.
Yeah, thank you for sharing that. Up next, we'll dive a little bit more into some of the more local impacts of statewide policies and also things that are happening at the local level in our schools. This is the Maddy Report. Welcome back to the Maddy Report. We have the numbers, rates of depression, anxiety, and tragically, suicide attempts, specifically among youth, have been rising, especially since the pandemic. And school is often a home away from home for many young people. Susan, how are local schools working alongside, the County Department of Behavioral Health, and how, just in general, throughout the state of California, to be able to respond to some of these issues that youth are facing?
Well, I'm really happy to say that Fresno County has been a leader in integrating county behavioral health and schools. This dates back quite a number of years. We had always been in the schools, our Department of Behavioral Health, providing services to youth with Medi-Cal. And yet it was challenging to penetrate into the school culture as healthcare professionals. And through the support and vision of the former superintendent of schools, Jim Yavino in Fresno County, and the former director of behavioral health, DeJuan Utek, they supported myself and Trina Frazier of the superintendent of schools and our teams to envision a different future. And we had the support of the County Board of Supervisors to create a very unique partnership whereby we have contracted with the superintendent of schools to be a behavioral health service provider on our behalf as part of our network of care. And through this robust partnership, we have clinicians through FCSS under contract placed in all 32 school districts in Fresno County. And we talked earlier about those prevention and early intervention dollars through the Mental Health Services Act. We invested significantly in ensuring that we were creating a pathway for all youth. I mentioned that our Department of Behavioral Health, as the county mental health agency, we serve the population of Medi-Cal members. And there are many in our community and in our schools who are privately insured through employer-sponsored insurance or other commercial insurance. By leveraging our prevention and early intervention dollars, we were able to make sure that those clinicians in our partnership with Superintendent of Schools, we call the program All for Youth, those clinicians were able to provide, at minimum, a screening and assessment for any kiddo on a campus here in Fresno County, because we wanted to make sure that we were upstream to make sure that children are not falling through the cracks in the system, and we could use those funds to help care coordinate to other resources.
You mentioned that change. Are there any other changes either at the local, state, or federal level, or initiatives that folks should be aware of when it comes to mental health, behavioral health?
One initiative I'd like to highlight locally is the Suicide Prevention Collaborative. One of the ways that the Central Valley makes things work, because we are not as, we're differently resourced than some of our other counties across the state and some of the more populated areas. So we make it work by cross-sector collaboration, and we are very, very fortunate in our community that we have strong relationships across sectors. So whether it be county behavioral health, public health, social services, our justice partners like the district attorney's office, the public defender, chief of probation, our sheriff, our police chiefs, our hospitals, we all are in this together and we work collaboratively. And so, born from a crisis in our community back in 2017, when there was a cluster of deaths of young people by suicide, there was a call to action. And the leaders in that time came together to host a series of meetings just to say, what are the facts and what can we do? Born from that was this robust suicide prevention collaborative that has been in existence. We serve in the Department of Behavioral Health as the backbone agency, and we invest about $1 million annually in suicide prevention. And so while the national numbers of deaths by suicide spiked significantly, particularly through the pandemic, in Fresno County, the data shows that our deaths by suicide have actually stayed relatively flat. And so I think that this speaks volumes for the collaborative work in our community. We also, I want to highlight an initiative that's taking local suicide prevention call lines and creating a unified national number. So we've utilized our prevention dollars to invest in the suicide prevention lifeline that's operated by local trained professionals here in our Central Valley area. Multiple counties provide funding, Fresno County being the largest funder. And then with the national 988 initiative, that phone number now is an easy to remember number of 988, and I think it's really important for the public to know about that. One last point that's important to emphasize is the new mobile crisis that we provide. So beginning in January of 24, our community now has access to a non-law enforcement behavioral health crisis response team. It's an easy to remember number in Fresno County. My apologies, I didn't think ahead to bring phone numbers for other counties, but if a person is in the Fresno County area, they can call 559-600-6000.
We'll talk more about some of the mental health resources and challenges here in Fresno County and the San Joaquin Valley. This is the Maddy Report. Welcome back to the Maddy Report. So, Susan, you mentioned previously before we went to a break that there are some resource challenges, especially here in the Central Valley and in Fresno County when it comes to mental health. What does that look like for rural communities in Fresno County? I think often we think about the city of Fresno, some of these larger urban areas, but how are other cities and other rural communities getting those resources?
It's an excellent question. And, in our rural communities, the populations are diverse, as we discussed, and there are some challenges for access to care. And I want to be clear to emphasize that that's not unique to the public behavioral health system. In fact, the public behavioral health system, such as county behavioral health agencies in our network, we go to where people are at. That's part of the way that we deliver services. We call that being field-based. So our case managers and clinicians will travel out to meet the person where they're at in their community, wherever that may be. And I think one of the biggest challenges in the healthcare landscape, particularly in rural communities, is that we're not yet realizing the promise of parity. And so healthcare parity means that behavioral health conditions would be treated equally with physical health conditions, and people would have ready access to the services that they need. People who work in rural communities or live in rural communities, it's a long drive to get to see a therapist, for example, in the city of Fresno. If you live in Huron, there may not be a therapist that's on your health insurance panel anywhere within 30 miles. The other barrier with parity is that because of the increased demand, particularly post-pandemic, and we've done a good job addressing stigma, so people are talking about mental health more. So that increases demand, and that results in some challenges in the workforce. And so what's happened as a result of that is that there's, particularly in the commercial insurance space, it's hard to find a therapist right now. And some therapists are turning away cash pay clients because they're full. We don't have that luxury in the public system. We have timeliness standards and time and distance standards, and so we are continuing to be innovative in how we serve our rural communities. We have a great partnership with our friends at the library, and if we need to find space at a library to provide a service. And then I mentioned our great partnership with the schools. As part of the grant funding that we applied for, we were able to develop wellness centers that increase space, because we know treatment space is a limited commodity in our rural communities, so those schools are able to serve as a treatment hub.
That's a great thing to know in terms of that partnership between the library and your department. To know that there's some cross collaboration across different governmental departments is really important to meet the needs of the community. What are some other examples of programs or specific resources that may be available to rural communities in Fresno County?
So I think another thing to think about is the things that apply universally. So we mentioned 988, we talked about mobile crisis. These are things that are available to the general public. Other things that I think are very important for people to be aware of is what to do and how to ask for help. So individuals can contact us at our access line, even if they're not a Medi-Cal member, if they need help navigating the healthcare system and trying to get connected to behavioral health. The other benefit for rural communities, it's not a one-size-fits-all, but there is the ability to receive services through telehealth, which is through a video-based interaction. Post-pandemic, many of us have been on meetings via video conferencing, and healthcare can be delivered in that HIPAA-compliant, privacy-compliant modality as well. And for some people, that's a really good fit. It's convenient. They don't have to drive anywhere or find a ride somewhere. And so I think that's another solution that's making a place in healthcare.
That's great to know. Up next, we'll conclude our conversation on mental health in Fresno County in Central California. This is the Maddy Report. Welcome back to the Maddy Report. One specific challenge is the stigma surrounding mental health. Many people are uncomfortable or don't know how to talk about mental health. This can be even more pronounced in rural and underserved areas. You know, Susan, we were just sort of talking about this in the previous segment, but how else is Fresno County sort of working to change the conversation and really reduce that stigma that surrounds mental health?
So we've been really proactive in addressing stigma through our department's work and our collaborations. As we've mentioned, we work across sectors. And what we're seeing is that stigma is still permeating, and it looks different across cultures, whether that be racial groups, age demographics, and even occupationally, stigma can look different across different fields, for example. But one thing we're seeing with young people is that they are way more open to talking about mental health than the generations that came before them. So sometimes it's more of the conversation of listening to the voice of the young people with an openness to their perspective, because their experience is quite unique. And then when you layer on the pandemic on top of their generational viewpoint, it's important to be sensitive to their expressions. One of the things I think that's really important about addressing stigma is having the conversation and modeling that we don't seem to have discomfort talking about heart disease, diabetes, a broken leg, but still sometimes it's difficult for a person to say, my daughter has schizophrenia, or my mother is suicidal. And it's okay to talk about these things. Mental health conditions are far more common than many physical health conditions. And so we can each play a role to normalize the conversation about mental health in plain English, avoiding jargon of our industry, and set the stage for addressing behavioral health conditions, including mental health conditions and substance use disorders, just as on parity, if you will, as we do physical health conditions.
Yeah, how can the community prioritize those things moving forward, and how can the community sort of, seek out those educational resources to do their part in reducing that stigma and increasing that parity?
I'm so excited that you asked that. One of the things our department is really proud of is the way that we integrate with our community and truly listen with community and have our community drive the services that we provide. That's not just a requirement in the way that we're funded, but it's something that we appreciate and enjoy doing. So the way people can address stigma is by increasing health literacy, particularly mental health literacy, and learning about mental health conditions, learning about suicide prevention. And we have resources for that. We have an active presence on social media. We know that's how a lot of people receive information in this day and age. So folks can follow us on Facebook. We have a presence on other platforms as well. We do have a website where folks can receive more information. Also, I think it's really important to engage in conversation through community-based interactions. We host listening sessions and educational forums across all 6,000 square miles of our community. Everyone in the public is welcome to attend those, and we do always post those on our social media, and sometimes we also do them virtually, again, to reduce barriers to access to information.
Great. Well, thank you so much, Susan, for your time. Thanks for joining the Maddy Report today.
Thank you for having me.
Thank you for tuning into the Maddy Report. To learn more about the Maddy Institute, visit maddyinstitute.com. The views expressed in the Maddy Report are those of the individuals participating in the program and do not necessarily reflect the views of the Maddy Institute. If you'd like to share your thoughts about today's episode of the Maddy Report, please visit our website at maddyinstitute.com.